communicable disease branch of the Center for Health let our guard down, and we should abide by all the restrictions and measures, and to avoid social capacity in the public sector. We are great help, and they've started to give us their assistance at the AWE, that is the community treatment facilities. With their help, we can better use these facilities. Within March, there are 5 community isolation centers that have been completed with the help of the central authorities. They are those at Qingyi, Shantin, the Hong Kong Zhuhai Macau Bridge, Hong Kong Border Control Point, Artificial Island, Marsick Road in Fanling, as well as the one in Hong Shui Kiu. These centers are for COVID patients without symptoms or with a mild symptom. They serve a very effective role in stopping the transmission in the community. They also alleviate the pressure on the hospital authority so that the latter can focus on serious cases. There are also 3 sports centers that are converted to isolation and holding centers for the elderly. They will take over cases referred to them by the HA after assessment. These centers are for those who are recovering and are suitable for discharge. The holding centers will take care of frail elderly persons upon the referral of the HA. They are of mild symptoms and are recovering and in a stable condition, but cannot go back to home or their residential care homes. This will release more beds in the hospital authority facilities. Those who are isolating at home will receive additional measures in a more speedy way. That includes a material kit. The HA has started the use of the isolation care monitoring system. For those who are isolating at home or in community isolation centers for additional requests for assistance, they will be able to get health advice and relevant information. The system, once detecting high-risk confirmed cases, will transfer the cases to the hospital authority for them to reach out to these people by the patient support call center to give them assistance they need. That includes appointment in the designated clinic, as well as oral medication. As I've said, that we have revised our anti-epidemic measures. Recently, we have announced that in relation to vaccination arrangements, those between the age of 18 and 59, if they have already received 2 doses, they may receive the 3rd dose 3 months after the 2nd dose. For those above the age of 12 and with a weak immune system, they can also receive an additional dose 3 months after the 3rd dose. And those who are staying in residential care home can also receive the vaccination after vaccination. Now we hear from Dr. Chang. We have received 7,966 PCR confirmed cases and 12,116 cases that are RAT positive. The total number is 20,082 cases. So the accumulative number from PCR and RAT since the beginning of the fifth wave, the number has exceeded 1 million. That includes 666 cases or so that are PCR positive and 338,000 cases or so that are RAT positive. Of these 7,966 PCR positive cases, there are 1,279 cases picked up by the hospital authority, 1,383 picked up by public health laboratory service, and 5,304 cases picked up by private laboratories. In relation to variants, we see that we don't see any L452R positive cases. 260 of them are negative to L452R, and the remaining 1,123 cases are either pending results or with low viral load, too low to be detected. There are 3 imported cases. 3 of them are picked up on the same day when these people arrived at Hong Kong. 2 from Vietnam arriving on the 27th of March via VN594. 1 from Indonesia flying with MH072, also arriving on the 17th of March. From the HA, they have reported an addition to $159 deaths. 206 of them were cases in the past 24 hours. In relation to 2,030 females and 3,158 male, aged between 11 months and 112. Similar to previous analysis, 58% of them are residents of care homes, and they are elderly people above the age of 80. They account for the majority. For the preliminary death rate is 0.5%, and over 70% of the cases are of the age above 80. And for that age group, the death rate is 8.5%. For those that have received at least 2 doses, the death rate is much lower, 0.09%. And those that have received less than 2 doses, 1.32%. There's a difference of over 14-fold. For those above the age of 60, for those who have received vaccination is 0.38%. Those who have received less than 2, 3.8%, a difference of about 10 times. Amongst residential care homes, there are 10 reports of cases, including 7 residential care homes for people with disability and 3 elderly homes involving of all residential care homes for people with disability. 227 of them involved elderly care homes, that is 28%. So altogether, we're talking about 9,000 residents and 2,331 staff members being affected. That's all for my report.
Next up, allow a brief you on HA situation. Good afternoon. We have 10,532 patients receiving treatment in public hospitals. The North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, and AWE Community Treatment Facility. Last night, received reports of 65 patients in critical condition, 115 patients in serious condition, and we have 115 critical patients receiving treatment in ICU. As of midnight tonight, over the past 24 hours, 206 COVID positive patients passed away, and they were 122 males and 84 females with age ranging from 22 to 106. I'd like to give a case analysis of 206 patients who passed away. 126 patients were care home residents. 114 of them did not have any vaccination record. Among the 49 patients remaining who passed away, 49 received 1 jab, 31 received 2 jabs, and 2 patients received 3 jabs. For elderly above the age of 65, there were 126. Now, I'd like to highlight some of the cases involving younger patients. First, a 25-year-old patient. The patient had congenital renal problem, suffering from hypertension and requiring long-term medication. The other patient, aged 46, resided in a residential care home for the elderly. This patient had a renal impairment requiring dialysis. A 50-year-old patient suffering from lung cancer and is in metastatic status, spreading to the liver. A 51-year-old patient, also a cancer patient, had metastasis to liver and other organs. A 52-year-old patient, also a cancer patient, cancer spreading to other parts of his body, including liver. A 54-year-old patient suffering hypertension, diabetes, and repeated strokes. And he also resided in a care home for the elderly. A 54-year-old patient with hereditary cerebellum issue, atrophy, and also chronic illnesses. A 56-year-old patient with a previous record disorder. Finally, a 62-year-old patient also residing in a care home for the elderly. Late-stage renal 20 male and 23 males with ages ranging from 62 to 103. In the past 24 hours, 1,074 more patients were discharged on recovery. To the post. That's all from me. The floor is now open. Please state the meeting.
some sort of vaccination plan specifically for elderly people. For example, at-home vaccination plan. So, if so, when will that at-home plan is being
In the past few weeks, we have set a target of outreaching to all the residential care homes for the elderly to provide the vaccination for them before or before the 18th of March. So that is one approach to ensure the elderly in a certain environment will get the vaccination. And of course, the other group of elderly is those community dwelling elderly individuals. So we have been trying very hard to improve the access for vaccination by providing more vaccination centers, even vaccination centers that are designated for elderly people, and also mobile vaccination vehicles reaching different, for example, estates where there are more elderly residents. And the other plan is to provide outreach vaccination for people, including elderly people who may have, say, mobility issues. So that is also one of the plans. And of course, we are aware that the eligible patient groups, I think we are always reviewing the scientific evidence on the effectiveness of these oral medications, and then we will plan the purchasing strategy and also how to prescribe these medications to the most needy population to protect them. So I think the clinical guidelines
Right in pink. I'm from orange. Well, there is an information